Systemic circulation. So AP 120, Chapter 13, Topics, Systemic circulation. So there are two circulations, as we know. There's pulmonary circuit. This is where the vessels are carrying blood to the lungs and then back to the left atrium. Starting out with the right ventricle that sends blood to the pulmonary trunk, sends blood through the pulmonary arteries into the lungs, and then they go through blood vessels and get smaller and smaller, and then the capillaries where the exchange occurs, and then via the pulmonary veins back to the to the left atrium. So right ventricle to pulmonary trunk and pulmonary arteries to lungs, alveolar capillaries within the lungs allow for the exchange, then pulmonary veins back to the left atrium. All right, pulmonary circuit. Again, right atrium through the tricuspid valve into right ventricle, then through the pulmonary valve into the pulmonary trunk, then splitting to the right and left pulmonary arteries to go to the lungs. And then blood returns via the pulmonary veins, right and left pulmonary veins, and into the left atrium, pulmonary circuit. Then we have, of course, the systemic circuit. In the systemic circuit, we have lots of vessels carrying blood from the left ventricle all the way throughout the body and then back to the right atrium. So oxygenated blood goes from the left atrium through the bicuspid valve into the left ventricle, then from there through the aortic valve into the aorta. We also have blood going to the right coronary artery and left coronary artery for the coronary circuit, coronary circulation. But most of the blood is traveling up the ascending aorta through the aortic arch, where some of the blood continues along the aorta, but some of it goes into one of these three arteries branching off the superior portion of the aortic arch. Includes the brachiocephalic trunk, the left common carotid artery going to the head, and the left subclavian artery going to the left arm. So the three arteries coming off the top of the aortic arch are, from right to left, brachiocephalic trunk, left common carotid artery, and left subclavian artery. The brachiocephalic trunk will then split into the right subclavian artery going to the right arm, and the right common carotid artery going to the head. So the common carotid artery then, as it's going up the neck, will split into the right internal carotid artery and the external carotid artery. Surprise, surprise, the internal carotid artery is going into the skull, going to the brain. The external carotid artery is going more toward the surface structures of the head. All right, so here is the right and left internal carotid arteries heading toward the brain. So here's an inferior view of the brain. This is the bottom of the brain that we're looking at. So blood arrives via the right and left internal carotid arteries. Also, blood is arriving from another artery called the basilar artery. And these arteries now lead to what's called the cerebral arterial circle. So this is a circle of arteries that all interconnect. And this is important because this helps to bypass areas where there may be low blood flow so that blood is able to reach most to all parts of the brain sufficiently. All right, so again, the basilar arteries arrives and splits into the right and left posterior cerebral arteries. Surprise, surprise, the posterior cerebral arteries carry blood to the back of the cerebrum. Then we have the internal carotid arteries. They split into the anterior cerebral arteries and the middle cerebral arteries. And surprise, surprise, those are carrying blood to the anterior and middle regions of the cerebrum. So again, the right internal carotid artery splits into the right middle cerebral artery and the right anterior cerebral artery, and ditto for the left side. Now, the right and left anterior cerebral arteries are connected by a small piece of artery called the anterior communicating artery, communicating between the right and left anterior cerebral arteries. And then the posterior cerebral artery is connected to the middle cerebral artery with an artery called the posterior communicating artery. We have one on the right side and we have one on the left side. So the posterior cerebral arteries connect to the middle cerebral arteries via the posterior communicating arteries. And so this gives us that cerebral arterial circle. See, it makes a circle. And here is a angiogram of the main arteries and the head of someone. And here is the arterial circle. And you see that there is a piece of that arterial circle missing. So there's some sort of obstruction preventing blood flow between the left posterior cerebral artery and the left middle cerebral artery. But again, because we have this circle, as it were, in that area, it allows for blood flow to bypass that blockage and therefore avoid ischemia or reduce blood flow in the brain. So our cerebral arterial circle gives us redundancy so that we can try to make sure the brain is always receiving the blood it needs. All right, that was the head. Now we're going to talk about the arms. So, as we know, we have the subclavian artery. Subclavian artery will carry blood toward the arms. The subclavian artery then turns into the brachial artery, and the brachial artery will split, giving us the radial artery running along the radius, and the ulnar artery running along the ulna. So again, the direction of blood flow is toward the fingers, is distal, and the subclavian artery becomes the brachial artery. Not like, say, driving down the street and having the street you're on change its name. The subclavian artery becomes the brachial artery, and then the brachial artery splits into the radial artery and the ulnar artery. In the lower portion of the body, the aorta will become the abdominal aorta when it's in, surprise, surprise, the abdominal cavity. Very thick, very large artery the abdominal artery is. There are lots of smaller arteries branching off of it, going to all the various organs in the abdominal pelvic cavity. But we just have to know about the abdominal aorta. When you get to the inferior end of the abdominal aorta, near the pelvic cavity, the abdominal aorta splits into the right common iliac artery and the left common iliac artery. And the common iliac arteries are going to the legs. The common iliac artery will then become the external iliac artery. And then when it enters the leg officially, it becomes the femoral artery. So common iliac artery to external iliac artery to femoral artery. So once it's in the leg, it is now the femoral artery. And then that branches into lots of other arteries all throughout the legs. All right, that's carrying blood away from the heart. And now, of course, we have to return blood to the heart. And so we have veins carrying blood back to the heart. So in the arms, we have some superficial veins that are easy to see. A lot of people can even see them just by looking at their arm. So we have the lateral cephalic vein carrying blood from the fingers up toward the shoulder. And we have the medial basilic vein carrying blood from the fingers up toward the armpit. So cephalic, lateral, basilic is medial. The basilic vein will empty into the axillary vein, and then the cephalic vein will also empty into that, and then lead to the subclavian vein. So cephalic and basilic lead to axillary vein, leads to subclavian vein, carrying blood toward the heart. In the head, we have the internal jugular vein. So when people talk about your jugular, they're talking about the internal jugular vein, an extremely large vein carrying blood from the brain and from many of the structures associated with the skull and face. The internal jugular vein then meets up and fuses with the subclavian vein, giving us the brachiocephalic vein that then leads toward the heart. The right brachiocephalic vein merges with the left brachiocephalic vein to give us the superior vena cava, and the superior vena cava empties into the right atrium. Also worth noting that from the coronary circuit, the coronary sinus empties into the right atrium. All right, then we have blood returning from the legs. Two important veins found in the legs. We have, of course, the femoral vein, which is a deeper vein, and then the great saphenous vein, which is more superficial. So the femoral vein and the great saphenous vein fuse, and then as they leave the leg proper, they become the external iliac vein, which then becomes the common iliac vein. Then the right and left common iliac veins will fuse to form the inferior vena cava. Inferior vena cava will be receiving blood from the various organs in the abdominal pelvic cavity. And then the inferior vena cava will go up into the thoracic cavity and empty into the right atrium. And that is it for chapter 13.